think we are live. I have to do, no?
Yes, doctor. Hello, everyone. Welcome back to Tea Talks Tuesday. So we have finished our 2 years successfully, 2 years, and today we are here. Tea Talks Tuesday, the first of its kind of nutrition talk show. We have started with this in the first lockdown, that is on May 19, 2020, with the aim of creating a knowledge bank to all the nutrition professionals and also to the general audience, providing them the authentic nutrition knowledge. And today we are turning 2 with more than 95 experts from nutrition and health field with varied interests from across the globe shared their knowledge on this platform. TeaTalks created lateral networking, opened new avenues, led students to make career decisions, helped health conscious acquire knowledge and awareness. And many patients cleared their doubts and gained a lot of confidence from this show. What an amazing journey it was. And on this special occasion of Tea Talks, we are happy here to, we have two esteemed speakers over here, and Dr. Sakthivel, who is a endocrinologist, expert endocrinologist with a Hormone Clinic in Trichy, and Mrs. Shiny Surendran, who is a sports nutritionist and a preventive nutritionist from Chennai, is here today. And I would request Dr. Janaki to introduce the guests for the day. Over to you, Dr. Janaki.
Thank you, Mayuri, and welcome all of you once again to Tea Talks Tuesday. And I welcome our esteemed guests, Dr. Sakthivel and Shiny Surendran. It's really, we are very happy to have you on our platform. And I'm sure this is going to be one of the best so far. So, and to be, both of you to be here on this particular day, it's really something for us. It means a lot to us. So here we go, very brief introduction about Dr. Sakthivel. He's an endocrinologist from Trichy with 22 years of experience, and he specializes in thyroid treatments and has very effective and radical approach towards this condition. Dr. Sakthivel runs a hormone clinic in Trichy, and you can download this Yellow Owl Hormone Class app. What is it, sir? You can explain probably later. So that is available on Play Store. This I saw in the Insta. You can check on him on his Insta at drsakthivel.endo. So we welcome you to Tea Talks Tuesday, sir, once again. Next, our I would say beloved, because I keep watching her talks on Insta, and just every time you watch, I get one message to take home, something to learn from your talks. So thank you, Shiny, for those talks. The name of the talks, I think, is eating mindfully, right? Eating mindfully.
Art of eating.
Art of eating. Sorry, art of eating. Yes. Yeah.
Thank you, Dr. Janaki, for the kind introduction and the invitation to be here.
Thank
Congrats
you
on the 2nd anniversary.
Thank you. Shiny Surendran is an internationally acclaimed sports and preventive nutritionist with 21 years of experience. And is practicing in Chennai. Apart from being a weight management specialist, she specializes in PCOS, insulin resistance, and type 2 diabetes management. And you can check her Insta at Shiny Surendran. So once again, welcome Shiny to our TeaTalks platform. We both once again with claps welcome both our chief guests today. So here we go. Maybe all the audience who are here in Zoom and who are watching in Facebook can type your questions in the inbox, or who are on the Zoom can open your video and audio and ask questions whenever you can. But before we start, we'll start with Dr.Sakthivel today. So while I keep seeing patients in my clinic, sir, I keep telling that we are not human beings, but we are hormone beings. So what is your opinion? I'm just simply keep, I just simply keep saying that, but how serious it is. I mean, the statement of being hormone beings.
Good evening, ma'am, and congratulations on second anniversary of TeaTalks. Thanks for having me here today, and thanks to Shiny ma'am as well. When I did my fellowship in endocrinology, my chief used to have this printed in his small brochure that we are all puppets in the hands of hormones. Okay. So it's like that because depending upon which hormone is going to be dominant in which phase of your life, we change. We feel hungry, we feel loved, we grow. So there's so many things which are not in our control. So when you say we are hormonal beings, yes, I coined the word that hormones are the BGM of your life, the background music.
Background music.
So you don't appreciate it unless suddenly the BGM stops.
Good one. Okay. Somebody.
Yeah, carry on.
Carry on, sir. Okay,
so,
sir.
Yes, ma'am. So you are absolutely right when you say that we are hormonal beings, and most of our emotions are also based on our hormones. So when we say human, being emotional, you indirectly mean to say being hormonal.
Or at least to recognize the hormones, what is happening with us.
That's the basic difference between a robo and a human being, the hormones.
Okay. Thank you, sir. So my statement is valid with your okay confirmation. Thank you, sir. So to Shiny, given the population deceased people, maybe just about 10%, if we consider, but remaining 90% are normal only. So as a preventive practitioner, that means 90% is a large population. So as a preventive practitioner, we have a large population at hand. How can we reach them? Or what does your experience say?
Yeah. So Dr. Janki, congratulations on the second anniversary. And you started off with such a fantastic question to Dr. Sakthivel about, how we are hormone beings. And I think as women, we are all, we have experienced so much in our teens, in our 20s, 30s, and then later 40s, 50s. It's quite a different journey. And we know how our emotions are totally controlled by, hormones and
roller coaster ride.
Absolutely emotional upheavals and whatnot. And I just love the way you said hormone beings, and Dr. Sakthivel also validated. Thank you for that. And regarding this, this is a fantastic question about preventive nutrition, because we always, when we are in college, we think about becoming dietitians in hospitals and serving the ones who are unwell. But there is this 90% who are outside the hospital, who are like ticking time bombs, who don't know they have certain health conditions, if not addressed, will eventually end up in hospitals. And they might end up spending so much money, several lakhs. And then also not just the money, but it's the time, your productivity at work goes for a toss, and there are so many aspects. So if we can just catch them right there and keep the ones who are healthy, healthier, or the ones who are in the borderline, we can actually help them reverse. And I think that's an amazing opportunity that we all have, and people really don't see that opportunity. That 90%, if we can work with, the results are fantastic. And it's very gratifying when people come back and say, I've stopped the medications, or I'm not pre-diabetic anymore, I don't have insulin resistance or PCOS or hypothyroid medication, or rather the thyroxine has been stopped because my endocrinologist has told me, like, you're fine, you needn't take this anymore. So I think that's a kick that you get as a professional. You feel so, that's an adrenaline rush. So how do we reach out to such people? It's about going to various schools. If we can talk to schools. Earlier, we also worked with one of the schools in Chennai. We realized that the teachers were highly stressed and they needed consultation.
True.
So we extended that support to them as well, because teachers are so stressed. They have to take care of their home. And in most of the homes, you can't, handle, say, 1 or 2 children. But then the teachers are handling a class full of 40, 50 students of high energy. So the challenge is a lot, right? So this is what we get to see. So if we can reach out to schools, give talks there, go to even any of those sports associations and all that, because you get to meet the children as well as the parents under one roof, and that's amazing. And social media is such a powerful tool. So just like how you're having tea talks, and this is just around 4 p.m. And, if you have a tea by the side or coffee and then having this conversation, I think this is a fantastic tool to reach as many people as possible. And also writing articles in regional languages. In
Right.
India, I think it's very important to put out information in regional language.
Regional language.
Yes. And that really reaches everywhere, the nook and corner, even villages. The other day, last week, I was in Kodaikanal. We went for a trek. And then in one of the orchards there, the worker there, okay, he was on the phone. So this is in the middle of a forest, and you don't see any individuals there. There were just hardly any people. But then he was using the phone there in the farm, which was actually growing passion fruit. So I was just thinking, see the power of cell phones.
Yeah.
And I think if you put out videos, which are, say, 30 seconds or 1 minute, and if that can be circulated in regional language, you can reach a lot of people. You can raise a lot of awareness.
True. It's really great. It saves mental and financial trauma. So really, yeah. Thank you. Mayuri.
Yeah.
Can you ask me?
So here my question goes to Dr. Sakthivel. So doctor, there are many people who believe that a lump of nodule in the thyroid means a cancer. How can one differentiate this? And is there any thumb rule kind of thing, how we can differentiate and all?
Okay. Hello, ma'am. Basically, you're asking about a nodule in the neck, whether it's arising from the thyroid, or whether it is arising from the thyroid, but you're not sure whether it's malignant or non-malignant.
Yes.
So, either ways, I as ma'am was saying, I have an app called the Yellow Owl Hormone Classes, where I do pre-recorded videos of masterclass in thyroid. So there we approach it as saying, when you're talking about thyroid, there are two things to it. One is the function, the other is the structure. The function of the thyroid, you know by checking the blood test.
Right.
The structure is done by ultrasound.
Right.
So ultrasound neck is the most sensitive method by which you can know whether if you have a nodule in the neck, whether it's arising from the thyroid. And if at all it is arising from the thyroid, then depending on the various characteristics, there's a scoring system called the Tirad score. So we look into the Tirad score, and if the score is high, then it is more suspicious of malignancy. The score is low, it is less suspicious. So when you are doing an ultrasound thyroid, you should make sure that you get a Tirad score for that. Just like for breast lump, they have a Birad score.
Okay.
So for thyroid, they have a Tirad score. So so ultrasound would be the answer.
Okay, great. Thank you, doctor. And my next question to Shiny. When on thyroid medication, is it important to avoid cabbage, cauliflower, basically the cruciferous? Many people, clients who come to us also, they keep asking this question. Like, do we have to really avoid cruciferous vegetables? And especially again, how about soya and flax seeds intake? They generally have these questions. So what is your take on this?
Okay, I would like to, because you both are practicing dietitians, I would like to know your opinion as well. So as far as we are concerned, or rather what we do in our clinic is, we do recommend, but in small quantities. It's not that, we consume cabbages every day. Not many people like to eat cabbages, and they would hardly have, like, say, 1 cup, and that to say once a week or once in 10 days. And I don't see a big issue there. And the other factor is flax seeds. We continue to recommend and soy in the form of tofu, or else if it's a it's a fermented product, so that's perfectly fine. I do recommend, but not in excess. So
Right.
earlier in the 80s, there was a phase when there was soy in all the 3 meals and also for snack. That was a sweep across the country where soy was being promoted
Promoted.
Oh,
very,
yes.
very aggressively. So that is not something that is recommended at all. But in small quantities for one meal once a week is something that can still be given. But I would like to know what you both do in your clinics or in your practice.
It's the same from my end. It's the same thing. I mean, I do educate them that, you know, the quantity and the frequency that you consume is what is matters. It's not that, you know, the one whole thing you consuming it in a day with a larger amounts. So yeah, and we have one question from audience. Pranita Reddy is asking, can a hypothyroidism patient consume Brazil nuts?
Brazil nuts are good in selenium. Yes, they can consume.
So audience, we have two experts here, Mrs. Shiny Surendran, who is a sports nutritionist and a preventive care nutritionist, and Dr. Sakthivel, who is a endocrinologist. So any kind of doubts that you have or any questions you have for them, please unmute yourself and you can just shoot up your questions. They are here.
Can I ask a question?
Yes, Simi.
Yeah, good afternoon, everyone, and congratulations for your second anniversary. My question is, many clients who come to us who are having thyroid and they're on thyroid now maybe 25 mg or maybe on 12.5 mg, and with a proper diet and with a lot of breathing exercises, it does come back to normal, but the doctors here do not allow them to stop the medication. And there is a lot of problems in terms of the dosage of the medicine that has been given to clients. So what can be done, or how can we create an awareness them, and what it?
Okay.
Dr. Sakthivel.
Yeah. So again, I'll go back to the masterclass where I talk about this. Basically, when whatever is taught in textbook is a little bit different from what we see in general practice. What I've noticed is when you're talking about hypothyroidism, hypothyroidism itself, there are two types. Okay, I'm not talking about what causes hypothyroidism, but hypothyroidism itself, there is one which is called the real hypothyroidism, where there is a problem in the thyroid, and there's another one called the relative hypothyroidism. And this is what I found out after 7 to 8 years of being a consultant. And the people with relative hypothyroidism actually do not have a thyroid problem. They have obesity as a problem. Okay. For example, thyroid is maintains your metabolic levels, and it was designed for your ideal weight. For example, if you are supposed to be 70 kilos and you are 90 kilos and your TH is slightly raised, say 6 or 7, in such cases, I find that this is a relative hypothyroidism. It's not a real hypothyroidism. A real hypothyroidism is the patient is not obese, the TSH is about 20. When a person is obese and the TSH is less than 10, in such cases, when you lose weight while lifestyle changes, the thyroid normalizes, in which case we can stop the medication. So there's a small thin line differentiating between real and relative hypothyroidism. So this terminology of relative hypothyroidism itself is my own, because in books they don't give it as that. They just say hypothyroidism. But when I look into the percentage of people who have relative hypothyroidism, it is a mind-boggling 40 to 50%. So 50% of people who think they are hypothyroid may actually be having a relative hypothyroidism, which can come down or at least reduce the dose, or you can even stop it if they're on a smaller dose, if they can work on their lifestyle. I hope I answer your question.
Yes, you did. Second question is, it's regarding myself only. I was diagnosed as hypothyroid around 8 years back. That time my level was just around 6. but they started with me on a medication. Now it's been a year without the consultation of the doctor. Sorry to say, I have stopped the medication and I'm still normal. I mean, I get my blood parameters checked every day, every 3 months. So do you think it's because many of them scare me by saying that because I stopped it? Of course, I did a weaning process in stopping before I took this decision. So now I'm off medication. I'm not taking any. So wanted to know, is there anything that I can do to get it checked whether I'm on the right track or not?
That's what I said, ma'am. You probably had a relative hypothyroidism. And once you corrected your lifestyle, and lifestyle meaning the most important thing which I see which affects women hormones is the circadian rhythm, which is your sleep cycle. So because say night 9 o'clock your melanin starts being produced, 10 o'clock your growth hormone is produced, morning 4 o'clock your cortisol, 5 o'clock your thyroid. So everything is circadian based. Now, if you're not going to sleep properly and if you're not going to sleep in the dark, then all these things go for a toss.
Right.
So when I say lifestyle, it is not only diet. And of course, when I say lifestyle, it also means diet, especially this new concept called the gut microbiome. Meaning, for example, someone asked about Brazil nuts. Now, if you are in Brazil and if you take Brazil nut, that's fine. Brazil nut has selenium, it can be taken, that is fine. But when you're looking into the aspect of taking a foreign nut, which is not indigenous to your country, there's also this concept called microbiome, which means that the gut bacteria are not used to the bacteria which are found in this food, and therefore if you're going to take something exotic, which is not a part of your indigenous food, sometimes that can also lead to autoimmunity. I'm not saying you should not take it, but there's also this possibility which you should also entertain. So yes, probably in your case, lifestyle modifications and a relative thyroid deficiency got corrected.
Okay, thank you so much.
Talking about autoimmunity, sir, I just forgot this. What exactly causes autoimmunity? I mean, it's a syndrome. I mean, is it a syndrome or it's kind of multifactorial or a specific? I mean,
it's like asking it's like asking what exactly causes happiness. There's no specific answer to that. When you're talking about autoimmunity, the first thing that people say is there's no single cause. So it's going to be multifactorial. But having said that, we have to look into the commonalities of things. And I think before a person gets autoimmunity, they are in a phase of chronic inflammation. Okay, a phase of subclinical chronic inflammation, which irritates the immune system, leads to autoimmunity.
Any markers or anything that we can identify?
So when you have a subclinical chronic inflammation, then we have to look into, markers are plenty. You have CRP, ESR, D-dimers, so many things which you use for inflammation. But my question is, you have to go one more step forward, thinking what can cause these chronic inflammation, which can be the triggers.
Right.
So the triggers, as I said, are mostly lifestyle related, like the food you eat, whether it's processed, whether it has more plastic in it, what time did you consume it, how did you cook it, when did you sleep, are you happy, how's your emotional status? So all these can be triggers. So there are triggers which lead to inflammation, and this inflammation can lead to immune changes, which can either go for malignancy, or they can go for a tumor, a solid nodule, or they can go for autoimmunity. So you see that all these three are increasing, like autoimmunity, malignancy, and nodules are increasing nowadays because of chronic inflammation. And this chronic inflammation is because of multiple triggers.
Right.
So this is my idea of autoimmunity.
So Shiny has put a message here, I think, for everyone. Pranati has asked, Prashanti asked about Brazil nuts. Cashew is a good substitute to Brazil nuts. Yes. Eat Brazil nuts in moderation or use nuts in rotation.
Yes.
Nut rotation, like seed cycling.
Yeah.
I also, when people ask me, can I take Brazil nuts? I said, yes, you can take Brazil nuts. But the question is, we should also consider this idea of a microbiome, gut microbiome.
Anything is okay as long as it is under moderation and control.
Yeah.
So this question to Dr. Sakthivel: people who do not lose weight, blame it on hormones.
Yeah, I get it. I see them every day. So most of my patients who come to me, either they go disappointed or they go enlightened. So it's very difficult to convince everyone. So that is something which I find very difficult. If I want to change a person's mindset or the subconscious belief system, it's possible only in one in 3 or maybe 1 in 4, which is 20 to 30%. The rest of the people will go disappointed.
Very true, doctor.
So what I try to do here is I do both hormones and lifestyle, because what I found after being a consultant for many years is that diabetes, thyroid, PCOS, and fertility, and most of these things, we are only trying to reduce the impact after the accident has happened.
Okay.
But we are not looking into what caused the accident. For example, for diabetes as such, we are not looking into why people develop diabetes only in the last 30-40 years. We say that it is genetic, whether it is actually not genetic, it is epigenetic. There's a difference between epigenetic and genetic. Once you say it is genetic, then the person thinks it is not under my control. What can I do about it? But once you say epigenetic, it means it is still under your control. So most of the times what we think as diabetes is a genetic hereditary problem, it is not a genetic hereditary problem, it is an epigenetic problem. So this is something which means we are putting it back on the court that it is still possible for you if you change your lifestyle.
Right.
So I also look into thyroid and PCOS in the same line as diabetes. And my idea has always been on, so I'm trying to develop a team where I have a dietitian, a psychologist, a physiotherapist, put it on a platform where people can be followed up for some point of time, unless they develop this belief system that it is possible for them to look after themselves, empower them to look after themselves. So I think that is how medicine should be. Not after you have say your HbA1c is 8, you're chasing numbers. What you need to chase is not the number, but the meaning behind the number. Right. The cause behind it, not the effect. But unfortunately, what happens is most of the time we are trying to just tweak the number and tweak the result. Why is the LDL 104? It should be 100.
100.
I know.
I mean, we can see correlate even in the diet also. Can I take like 1 cup or 1 teaspoon, 1 gram? The numbers.
Yeah. So we are so obsessed with numbers and one reason for everything. What is the cause of this? There should be only one cause.
I know. And many people, will be very strict on alcohol and food the previous day before they go for testing.
Yeah. That also very true.
That also is seen.
The costlier the testing, the number of days increases.
So we have one question to Dr. Sakthivel from audience by Neelam Jain. So what she says is, one person had TSH high and T4 low. After 3 months of lifestyle modification, TSH dropped, but T4 shoot up drastically. After another 3 months of again the changes, TSH is the same, but T4 dropped. What could be the reason?
No, it only means that it is getting controlled with the drug. TSH is basically not thyroid. It's T3 and T4 are thyroid.
Yeah.
People have a lot of confusion about which is the thyroid actually, because sometimes they say TSH is high and the doctor says you have low thyroid. They're like, what is he trying to say? So first thing I tell in my classes is that TSH is a very good screening test for thyroid, but it is produced by the brain. It is not produced by the thyroid. So TSH and thyroid function are inverse. So the first thing they have to understand. So when you're talking about hyperthyroidism because of an autoimmune cause, which is called Graves' disease, you're going to have high thyroid production, which means your T3, T4 is high, and therefore TSH will be inverse, which is low. Okay. Now, when you're giving a tablet to reduce the work function of the T3, T4, then slowly T3, T4 will come down and TSH will start to rise. Okay. So that's a normal way how it gets controlled. The most important question which they asked is whether Graves' disease can be reversed in women.
In women,
now, most of the autoimmune disorders are very common in women. Nobody knows what is the real reason why they are more common in women. Probably because of pregnancy. Because pregnancy is an immunocompromised state, and after pregnancy, most of them have this deluge of antigens being produced, and therefore autoimmunity is more common after delivery, postpartum period. But even then, some people who do not get pregnant as well get autoimmune disorders. So it's not very sure. We are not very sure. They say the gene for maybe the XX gene itself can lead to more of autoimmune disorders. We are not sure about that, but it's more common in women. Now, can Graves' disease be reversed? It's a very, very tricky question. It's very difficult to because the pathophysiology is not still fully understood. Why it happens, and why suddenly after 2 years it comes down, why again it shoots up. Graves' disease usually having a phase where it's there for 2 years and then it's normal for 2 years, and again you have it for 1 year, then it's normal for 5 years. So it's a wavy one. It's not in a straight line. Okay. So the answer to that question from my side is I still don't know. Can Graves' disease be reversed in women? But any autoimmune disorder for that reason, even Graves' disease, there are a lot of evidence that shows the stress causes Graves' disease. Stress. We usually ask this question to anyone who has Graves' disease. We ask this question particularly that has there been someone any demise in the family within the close circle in the last 1 year? Okay. This is a very pertinent question that we ask. If there has been a death within the last 1 year, or if the person has migrated to another country where the temperature has changed drastically. For example, from India, you're going to minus 20 degrees Canada. Okay. Or you go to plus 50 degrees somewhere. So whenever there's going to be a drastic temperature change, migration, or there is going to be an emotional problem, Graves' disease is more common. So what we can understand from this is, so the environment and the emotional aspects of the immunity have some say on Graves' disease, but we still do not know how to reverse it. We're just learning.
Right. Keep learning. We keep learning. We keep learning as patients come, isn't it? So next question is to Shiny. How can one break the set point, the so-called set point? It keeps coming all the time, like how we blame it on hormones. So, and how long it takes before the body resumes weight loss?
Okay. So the way we approach, from all these years of experience, what I've seen is like, just like how Dr. Sakthivel mentioned, theory is different, practice is different. And it's not always about nutrition, but we also have to see the person holistically. So just like he had mentioned about how belief system is very important. I'll give you an example. I remember a client had called up from Munich in Germany, and she said she had gone to one of the top gynecologists in Munich. And over there, she had told, oh, you have PCOS and it's difficult for you to conceive. So she was really in a shock, and she was so pained with that. Because see, when you're going to a doctor, what happens is first is getting an appointment. Next is going and waiting outside the waiting room. Your mind has so many things that's coming up, right? You're highly stressed. You're wondering what they're going to say. And you've already placed this person, on a pedestal. And it's like a person who's sitting in an authority, right? It's an authority figure. And if everybody around you has told that this is the person who's the best in your city or whatever, then there is a sort of idea that you've already, preconceived idea with which you go. And when they say something, it can really go straight into your subconscious, and you have no clue what damage it can do.
Yeah, okay? The neural pattern.
Yeah. So with the best, see, doctors are out there to help all of us, no doubt. But it's also like how some certain patients or how they receive the news, right? So she called up, and the main thing was, I have PCOS. Will I be able to have a baby? That was her question. She didn't ask about diet. So where I spoke to her for 1 hour, and I said, since 2006, we've been seeing so many people, and PCOS and insulin resistance has a connection. But if you learn how to eat right, there are a few things that if you get it right for life, you can make sure that you won't get this, provided your lifestyle is good and you're also managing your emotions well. Your stress is also going to play a role and all that. We worked with her for 3 months, and then she conceived naturally. Okay, so the belief system also matters. So how we work is, main thing is, I work with a hypnotherapist. So this is a doctor who has done hypnotherapy. Some 3-4 levels of hypnotherapy she's done. She's done crystal healing. She's done past life regression. And she also gives affirmations and all of that. So there's a lot of baggage we carry.
True.
One is, okay, if you look at the science and all that, counting calories, understanding meal plate, besides all of this, there are certain things which we tend to overlook several times, like how the death of a loved one. or it could be someone who's going through a bad divorce. It could be years and years of litigation, right? Going to the court and coming, stepping into the court is not a great idea. Or, there's so much of emotion. Even 1 week before a infertility treatment, or else, going to see whether that embryo has clicked, whether there's going to be embryo transfer. There's so much of stress. You ask a man to go and give his sperm count, or rather, his sperm sample. It's a lot of stress for the guy as well. It's not just the women, right? So there's a whole lot of emotional aspect. So if you ask me, I was just telling my husband last month, earlier I used to think nutrition, yes, it's important, and then exercise. But then now I would put the psychology or the mindset, the mind-body aspect as number one, then nutrition and exercise, everything else. It's very important to see this from a multi-pronged approach, and to have a team, how Dr. Sakthivel is telling, to have a team like that. So we always work with a physiotherapist, a life coach, a hypnotherapist if required, because there could be childhood trauma. We worked with clients who have been sexually abused as children, or sometimes, they've gone through very traumatic incidents, and that actually stops them from reaching certain goals. So it applies to, it could be having a child, or it could be shedding weight, even that. Because there are times when people lose weight and then regain all the weight. You see them after 1 or 2 years, and you'll be like, where did I go wrong? Probably as a professional, you will feel you are a failure. You didn't. But it's just that person's life, what they've gone through. Or if they have, say, sometimes when we talk to the psychologists, they say have major low self-esteem issues. And when they start getting attention, when they've shed weight and they get a lot of attention, and if they're under the spotlight, suddenly, it kicks in, and they're like, I don't deserve this. I'm not comfortable with this attention. They'll go back to regain their weight, because again, they're going to be behind. They'll be part of the crowd. They don't want to be under the spotlight. So it's very, very important to work with a psychologist side by side, whether even if it's to break a plateau. So if we look at the nutrition aspect or the technical aspect of it, one is to see whether they are sleeping on time. So we would always recommend be in bed by 9:30 so that you sleep at 10. Number one. A lot of people don't do it because of gadget usage, OTT, and YouTube.
I raise my hand.
Cousins abroad, and now to make one WhatsApp call, free calls, you can talk for hours together. So all this thing has its own damage. Next thing is ordering foodstuffs from, say, Swiggy, Uber, wherever. 24/7 you have access to food. That's another thing. People don't even wash clothes using a bucket. If you look, just imagine the scenario where you're cleaning your handkerchief in a bucket. Okay, you have the soap and all that mixed in the water, you froth up, and you have the lather, and then what happens is you're cleaning up these small handkerchiefs and all that. So you will end up squatting in front of the bucket, right? That also is not being done, because we deal with teenage girls who are not doing any household work. Yes. You have like one child at home, and the parents are like so protective. They're not, walking around much, not doing household work. They're so pampered, and they're not doing so. Neat calories or non-activity, right? Exercise, that is non-exercise activity thermogenesis, that is neat calories. The activity of number of steps they take throughout the day. That's another thing. 10,000 steps is for maintenance. You'll have to look at 15 or 18,000 steps.
Yes.
That's another.
You increase the target now.
And also getting enough protein. That's a huge thing. Most people do not match up with that at all. And there are times that you get to hear in the fourth or the fifth follow-up that the client might not be drinking even half a liter of water. They might have forgotten to tell you that they're on antidepressants, or perhaps even I remember one client who said he had a lot of sandwich stores, some 10 shops across the city, hopping from one place to the other. He said, there are times I buy guavas, say 1 or 2 dozens, I keep it by the side. And as I keep driving around from one outlet to the other, I'll keep munching on guavas. So just even though guavas are healthy, you eat like a dozen a day, what will happen? So these are those little things that you really need to catch hold of, fine tune, and then figure out whether they are doing the basics right. And stepping up protein helps a lot. And sometimes being on a very low calorie restricted diet over a period of time definitely can affect the hormone health. Dr. Sakthivel is going to definitely throw light on that, because hypothyroidism is something that can develop. But besides that, doing calorie cycling, carb cycling, give a little extra, say at least for the 2-3 days, you can say, go eat a masala dosa, it's okay. order for that biryani, or else prepare biryani at home, or go ahead and have that little bit of pasta, but make sure that you're adding the red sauce and not the white sauce. So when you actually tell them, go ahead and eat this for the next 2-3 days, and they will come back with a weight loss. So you just need to do carbohydrate cycling. If they're on a 1,500 calorie diet for a very long time, it might help to step up their calories by 200 or 300 calories. That might help. But personally, I'm not someone who counts calories for my clients. Teach them food plate method, and also teach them what to eat when they go for vacations, for weddings, and say coffee shops, to restaurants. So those are the, yeah, that is very helpful. And the mindset is also very important.
Very important, right? In continuation to this, I would like to just add one this thing, my experience, Shiny. We have launched a program called HERA, and you were the chief guest in the last year. So where I being a holistic nutritionist and a friend of mine who was a life coach, Sri Haripriya. So we have started this program for the PCOS people who are suffering with PCOS and irregular menstrual cycles and infertility kind of issues. So recently we had one client at the age of like 16 years old. She was not getting her cycles on time. I mean, she has been suffering with this PCOS from almost from 2 years. So I'm immediately after, so I mean, maybe around 13, 14, that is, she got 13 years, 12 years, she was first menstruation. And then maybe about 2 years she got, and then 2 years she was not getting these cycles and overboarded with all the exams, schools, and, the school. She had a lot of baggage, emotional baggage. And we started trying to correct this emotional baggage with affirmations and burning process and a lot more into these things added. And in the 45 days of the consultations, she started getting her cycles every 28 days. I mean, the first 28 days she started getting it. Great. So I would like to acknowledge this on this platform again, where Dr. Janaki and Shiny was who were there to launch this program that in last year for the Women's Day. So yeah, now moving on to the next question, which is again related with the protein, again goes to Dr. Shiny. So post-workout protein plays a very major role. Okay, so how much and what form would be more, you can just suggest how much and what form, and in general of a workout session, what amount of protein needs to be consumed post.
Okay, so post-workout, whichever meal follows, say for instance, you're doing your workout in the morning, so the next meal is going to be your breakfast, right? So making sure that there is adequate protein, at least 20 to 30 grams of protein in that meal would be good. Overall, if you're looking at an entire day, at least they should match up 1 gram per kg body weight. Yeah, 1 gram. And also ensuring that they drink adequate water. Even today, like around 2 o'clock, I met a client, a young kid who's just in the 12th standard. She's doing her board exams. And she was asking, okay, how about protein supplement? Can I have whey protein? I'm looking at Instagram. There's an influencer who's doing so much workout. She's looking good. She's taking whey protein. So, and her face had so much of acne. So the main thing that I told her is, please, let's check whether you have food intolerance, gluten or lactose intolerance, because if you're going to take whey protein, it's going to cause a lot of acne. It's going to make it severe. And she wants to, look good, shed weight, shed the fat, get fit, wear smart clothes before she goes to the university. She's applied to Switzerland.
Oh.
So she's planning to go abroad and study, and she wants to look smart and, enter the college with so much confidence. So I said, you are a non-vegetarian. I don't see any reason why you need a supplement. Right? So I said, go ahead and eat a lot of fish, cook it with less oil, steam it, do any of the tikkas, grills, whatever, but make sure that you're eating this kind of food. So not everyone needs a protein supplement, and the meal that you're going to have next. So it could either be lunch after your workout or dinner after your workout. Make sure that you have a lot of natural protein. So it could be either plant proteins, different varieties of dals, or it could be a powder of nuts and seeds, or it can even be sattu powder, that is your roasted Bengal gram ka powder. Or it can be a dish like pesarattu, which is so popular in Andhra. I recommend it all the time to my clients. And also adai, which we eat a lot in Tamil Nadu. So adai again is lentil or the yellow colored dosa crepe that we have. That is also good. Dokla khanvi is also something that is recommended. But sometimes what happens is a person could be doing their workout, say in their office gym, and by the time they reach home, it will be 9 or 10 o'clock.
Yes.
In that situation, we might recommend, say, soy milk. Or if the soy milk quantity, or rather the grams of protein is very minimal, then you would recommend some plant protein powders if they are sensitive to milk proteins or
Milk protein.
whey or those. So it could either be whey or this, depending on the situation. And anyone below 18 is not given any kind of protein supplement. It'll be a good idea to consider 1 gram per kg body weight. And if it is someone with, say, perimenopause and all that, we definitely go up to around 1.7, 1.8 gram per kg body weight.
Okay.
Because perimenopause is a huge challenge. I would definitely love to hear what Dr. Sakthivel has to say, because even if you're eating this much, the weight gain is rapid.
Yes.
And over the past 3 years, personally, I've been through a lot of challenge because sleepless nights, hot flushes, and even if you are eating salads and all that, the weight gain or the waist size expands quite a lot. So I think perimenopause is a huge challenge. The moment one steps into, mid 40s. I would like to hear from Dr. Sakthivel what he has to say about perimenopause. I'm sure he has a lot of patience.
All fat cells want to put a meeting in the middle of the so-called.
Absolutely. I love the way you said it.
I always think that because I'm also facing the same. I'm post-menopause, but still I'm facing.
You're right. So protein, I think most of us don't even match 1 gram per kg body weight.
Right.
The sambar is very thin, or the dal that you're making,
Yes.
the papu that you're making is not very thick. So all these things matter. There's a lot to be done with the real natural food itself before even considering a supplement.
Right.
Doctor, anything you want to put on this? Your comments?
Regarding postmenopausal weight, I'm not really sure that it is the. Yes, you have some fat distribution, redistribution because of this change in hormones. But it could be also because, as I previously said, the psychological changes, the mood swings, we are not, the intention to eat properly or the intention to exercise, all this comes down. So it is as like everything else, there is no one reason for that. It could be multifactorial. It could be because of a dip in the hormones, along with other things like your motivation comes down or the mood swing is there, as well as your diet. So I'm not really sure there is one answer to that as to why people gain weight post-menopause.
Do you recommend hormone replacement therapy, doctor?
Hormone replacement therapy. Okay, that's a big chapter altogether.
Of course, yes, but I asked a big question. I know, but
we do that for people who are postmenopausal vasomotor symptoms. We usually do not go for hormone replacement therapy. We do that sometimes if it is between 45 years to 50 years of age person. But if it's going to be beyond 50, we don't do that. And if there's going to be a family history of say breast carcinoma or DVT, deep vein thrombosis or something, again, certain things which we should avoid hormone replacement therapy. Most of the times, vasomotor symptoms, we go with other medication, non-hormonal medications. We give hormone replacement when they have an early menopause. Someone who has an early menopause before 40, premature ovarian failure, or just after 40. For them, up to 45 years at least, we give them. It's a very small dose of estradiol which we give. If they have an uterus, we tag it along with progesterone. If they do not have an uterus, only a small dose of estradiol that we give. So it's a big topic altogether. A lot of new findings, which keeps on changing. Yes.
Right. Okay. In my practice, I found seed cycling to be helpful for menopausal women, which is taking different seeds in a cyclical manner. Actually, I think it is the act of taking the seeds in cyclical manner itself is something that is doing good for women. I felt, personally.
So probably it's a psychological thing, a placebo effect.
Yes.
Because the phytoestrogens, we are not really sure. Phytoestrogens, whether they convert into, how do they have their effect on the estradiol which is found in our body, we are not really sure. So we still do not have much evidence to say that, but as you said, probably the act of doing it itself can make them feel better.
Right.
And also the seeds themselves are quite good nutritionally. So some nutritional deficiencies might have been corrected, and that also must have, they feel more happier in the sense the mood is better than before, and vaginal dryness, hot flashes, these things have actually come down in my patients. That's what I found in my patients. Okay, so next question.
Same again. Question goes to Dr. Sakthivel only. So yeah, generally, if a couple cannot conceive within 6 months of their marriage, what happens? Parents start showing them to doctors, and they are back of them like, go meet doctor. What is wrong? So what exactly at what stage can one be called as infertile? And also to this again, why IUF and IVF have become common these days?
Okay. This is very fertility has to be dealt with from different angles. It's like seeing the elephant, different blind people looking at it from different angles and saying what it is. I can only say it from the endocrine perspective. The gynecologist will have definitely a different view about this fertility issue.
Right.
One more thing I wanted to add is when you said about an adolescent girl with PCOS, one aspect which is usually left behind a lot of times is that, yes, a lot of these people with PCOS have it because of their lifestyle, that is fine. But sometimes PCOS is a diagnosis of exclusion. Basically, after ruling out certain things only, you can label a person as PCOS. And the latest guidelines say that you should not label an adolescent girl as PCOS.
Right.
So
Okay.
adolescent girls should never be labeled as PCOS. They can only be labeled after ruling out other causes as at risk for PCOS.
Okay.
Okay, so less than 18 years, you cannot put them as an adolescent PCOS. That is not allowed now. You can only put they are at risk for PCOS.
Okay.
And that also after ruling out the other causes. Now, what do you mean by other causes? That then the endocrinologist comes in. We rule out adrenal causes. Usually, when you're talking about PCOS, people do not look into the adrenal. It is the endocrinologist who looks into the adrenal.
Yes.
Now, when they say PCOS, what they mean is there is androgen excess and an ultrasound showing cysts in the ovary. Just because these two are there doesn't mean that the problem with the ovary. It can also have an hypothyroidism can produce the same effect. Prolactin excess can produce the same effect. Adrenal problems can also produce the same effect. So unless you rule out all these things and you do not know what is the cause, only then you can use the umbrella term called PCOS.
Okay.
So that is one thing I just wanted to say. Now moving on to fertility, usually if a couple have unprotected intercourse over a period of 1 year and they're still not able to conceive, that is when they are usually referred to fertility specialist or someone. Now the term again infertile is discouraged basically. What I write is probably subfertile. We need to look into what causes this subfertility. It can be anything from obesity itself. The couple, most of the times when you look into the journey of the couple, the first 1 year they're going to gain weight usually, and most of them, this weight gain itself can lead to hormonal issues. So, so whenever there's going to be a weight gain or they're not able to conceive, one is we look into the endocrine perspective as a hormonal doctor. We look into the male and the female into these endocrine perspectives. If the endocrine perspectives are normal, then we refer it to the gynecologist, who's a fertility specialist. And then they look into from the fallopian tube angle, as a tubal block, the cervical thickness, all those things they look into. So it is a teamwork which is done after at least 1 year after marriage. And again, this societal pressure of having a kid within 1 year also adds to the emotional baggage.
Okay, I know, true. So next question.
Yes. To Shiny again. 1 second. You can just continue.
Yeah. This one to this question again, Dr. Sakthivel, is why IUF and IVF have become more common now. They were not there before.
I think it is, as I said, I'm a big proponent of lifestyle changes. So I think what has been different in the last 30-40 years? Why do we get more of type 2 diabetes? Why are more of our children obese? Why do we have more thyroid problems? The same reason is the reason why we have more of IUI and IVF. Okay. So there's nothing going to be different there. it is all one continuum. It is not like separate things. Okay, so because your circadian rhythm changed, because your diet habits changed, because your life cycle changed, and all because of all these, your hormones also changed. So so when you're going to look into why you have IUI, IVF, it is not IUI or IVF. It's the question. It is what caused so much of fertility disorders, what caused so much of cancers, what caused so much of autoimmune disorders. If you are able to answer that, then we can answer this as well. So we do not have one particular answer. Again, there's no one answer to that. But what I'm trying to say is it's all related to the changes which happened in the last 30, 40 years, which you can put it under the term lifestyle changes or environmental changes, whatever changes. And also the mindset change, everything. So it's like people want it quick. Everything should be done immediately. So all
in
these
a pill
things,
form, everything to be in a pill form. Pop it up and you get the result.
What I find basically the difference between where I think modern medicine is going wrong nowadays is that modern medicine started out in the 18th centuries, mid 18th centuries, and it was very, very successful because it was dealing only with infection. Okay, so we were giving antibiotics, which was actually destroying the root cause. Okay. Now, what happened was after 1970s, when the nutrition became better, the hygiene became better, all these infectious causes came down. And now we have a lot of non-communicable or non-infectious disorders. But still our approach has been like as if we are approaching an infectious cause. A non-communicable disorder is a very different ballgame. A non-communicable disorder needs a team, and the patient or the person who's seeking the problem, he has an active role to play. Whereas in an infection, the patient does not have any role at all. Right. It is the doctor who has a role to play. He has to use something which affects the root cause. Okay. Right. But when you are doing the same thing, for example, a person with diabetes comes and you say, I will give you a tablet, will reduce the sugars, I'll reduce that number. It is not going to work in the long while because you're not looking into his nighttime when he sleeps, what he eats, and whether he gets up in the morning early or not, whether his relationship is happy, whether he is smoking and taking alcohol. If you're not going to look into any of these things, and if you're going to give only a tablet to reduce that number from 250 to 150, that you are going to end up with some other problem. Right. So this approach, the mindset of the medical fraternity, especially modern medicine, should be that we have two different things. One infective field, which is emergencies, critical care, infection, yes, continue the same. But when you're talking about chronic disorders, we have to look into a different angle. It needs teamwork. We need to learn about, as ma'am said, the psychology. We are not taught about diet at all. We don't have a paper on diet. We do not have a paper on physical activity. We don't have a thing on psychology. So we need to change all these aspects of medicine. If we think that modern medicine has to progress, then I think we need to delineate that whatever we have done the first 100 years was for a different problem. And what the problem we have right now is something different, which needs a different, as Albert Einstein said, that if you want a different solution, you should look at it differently.
Awesome.
Right now we are failing. Right now we are failing with the management of diabetes, cancers, autoimmune disorders, but we do not accept them. Once we start accepting them, then we'll then look into how to find a way to move forward.
Great, sir. This is modern medicine actually dealing with a non-communicable diseases. Some time ago, I saw one documentary in BBC which showed that all female fish turning into male fish, or male because there was some chemical that was going into the stream. There's some factory nearby, and some chemical is being thrown into that water stream, and then it's mimicking hormones, I believe.
Yes.
So probably we have to. It is kind of a serious problem, but how it applies to us, I mean, we have to really wait and see.
For my thesis in DM, my thesis was on childhood obesity. So we were looking into plastic exposure causing childhood obesity.
Like endocrine disruptors, right?
Yeah, endocrine disruptors, meaning plastics which contain that BPA. whether that is causing childhood obesity. So I was supposed to take urine samples of 50 obese boys and girls and 50 urine samples of non-obese people, and then compare and see whether these people have more of endocrine disruptors and all that. Now, first of all, we did not have a place to evaluate for this in India. Thankfully, we got an Indian who was in New York who helped us with this. But what we found out is that both the cases and controls had equal amount of
There's no control.
Yeah.
There's
So
no control
what we
group.
needed is a bigger number, and the problem was so huge that already even people who are not even obese still have the same problem. It has not manifested yet in them. This has manifested in them as obesity. Maybe it will manifest in them as hypogonadism, something else.
Okay.
Yeah.
Okay. From the audience, Smita says that number of stress factors are increasing with every year. I think during the lockdown, the number of IVF cases has gone down, and people who were supposed to get IVF procedures conceived naturally due to forced healthy lifestyle, home cooked food, and sleeping on time.
Nice.
And
I think she's talking about the initial first 3-4 months of lockdown.
Yeah.
Yeah, only that. Afterwards,
Yeah, so many.
madness.
I would actually agree with Smita. Yes, a lot of people conceive.
True. And Soumya says, resonating with your thoughts, Dr. Sakthivel, glad that she's attending this session. She's so happy to attend the session. And Smita says, COVID babies. Dr. Suresh Kumar says, breathtaking, Dr. Sakthivel. I'm a fan of you from now. Thank you for your time.
One last question to Shiny.
Yes. Oh, I'm so sorry. I had one last question again for our general audience. This is again, PCOD, can it be prevented? What are the nutrition guidelines?
Oh, okay. You're already working on that area, Mahira.
I know, but you are the expert for today.
Okay. So with PCOS, so the main thing is lifestyle is very, very important. So we definitely start. The first recommendation is to go to bed on time. Right. So sleep is very crucial. So you should be fast asleep at 10 o'clock, which means you should be getting ready to get to bed by around 9:15, 9:30, because you toss around, kind of settle down, and then start sleeping, right? So 10 is a good time to go to bed. So if that is done, great.
Doctor, sorry to interrupt you, Dr.
Sakthivel.
Shiny ma'am, so I wanted to ask you, how do you motivate people to go to bed early?
Same from me also.
Okay. Doctor, you won't believe, yesterday Suren and I went to sleep by around 9:30.
Wow.
Okay.
Yeah, we have, there are days that we have binge watched shows and gone late to bed by say 11:30 also, but we are there, almost there. So main thing is to motivate people. Okay, how badly do they want results? So if it is a young girl who's getting ready for her wedding, and she wants to fit into the lehenga, the gagra, show her tummy, look great in pictures, wants to post it on Instagram and all that, she's highly motivated.
Yes.
Okay, or it could be someone who's planning to run, say, for a marathon or getting ready for a very big event. It could be anything.
And yeah.
Then when intrinsically, if they're highly motivated, then you keep showing them, you want to reach here, you start with this, the foundation is this. You want to construct a building, say 20-story building, the foundation has to be deep.
Strong.
And strong. Likewise, sleep is the foundation. So first is that. Next is sunlight. And then, we also definitely do say that one is, of course, eating early, not using gadgets, taking a hot shower, magnesium supplements help, and then staying away or even switching off the modem so that they're not in that, electromagnetic that also matters a lot. And definitely not having a TV in the bedroom. A lot of people have television in the bedroom, and that's one of the major factors. And you watch something like a debate show at night, your mind is all the time thinking and racing. I think that's not going to be truly helpful.
Especially political debates.
Yes.
And the hormones kind of have a night party.
Madam, nowadays they don't have TVs in the bedroom. They have a cell phone in the bedroom.
You're right. It's like carrying your laptop to the bedroom, right? Yeah. And I think that's the biggest thing. So over and again, it's only about inculcating healthy habits and working on that aspect, because most people think you go to a dietitian, you're sitting there and counting calories, get a diet chart and job is done. No, it's about sustainability over a period of time and being consistent. Rather than looking at the intensity of the workout, it's like how long can you do the exercise? Do you have that as part of your lifestyle, where just like you wake up and brush your teeth, do you also walk, move around, be active throughout the day, and also manage stress? I think these are factors. Yeah, you wanted to say something, Dr. Sakthivel? Yes.
Yeah. So last year, when I had a small workshop on lifestyle for women, only for women, and it was during the lockdown. Now, what I wanted to do is exactly the same thing. Ask them to go to bed early. Now, but when you're going to ask them to go to bed early, when you tell it directly, nobody likes it. Like when, say, if they say that I have to wear this glasses lifelong, I might not like it. What I have to say is, you wear this glass, you'll feel better. And then we'll see later what can be done. So I've been wearing it for 20, 30 years now. So what I did is that if you have, so I put it as, we are going to have a 5:30 a.m. Class in the morning on lifestyle. Zoom meeting, 5:30 a.m. And 6 o'clock, I need a selfie with the sunrise.
Wow.
Okay.
Very
so the idea is there are 30 people in a group, and all the 30 are now logging in at 5:30 a.m. into the class. And 6 o'clock, we have a break for a sunrise selfie.
Okay.
And then 6:30 we close. Now, what happens after 3 days is the first 3 days, it's a 7-day or a 10-day program. Okay. Now, live show. Now, what happens after third day is that even if you're not sleeping, a person who sleeps late, but you want to attend the class. Now, after the third day, physiologically, you are so tired that you'll sleep early. Right. If you want to attend the class, or you will bunk the class.
Right.
Now, if you're going to attend the class 3 days, you will also find the goodness of getting up early. You have so much time. You have so many things you can cover. And slowly you feel that that goodness, the wellness of doing things. So I have seen that if you want them to sleep early, don't say that you want to sleep early. You give them a target which is exciting enough to get up early.
Right.
So like if you are doing that, if you give a good target, for example, morning we are all going on an adventure trip or something which makes them get up early, and which you can do that for 7 days straight, then they will get hooked onto it. So that is one small thing which I found out, that if you're going to say directly, don't eat bad things, it's not going to work. Make the good things better or better palatable. So something
very
like
true, very true. I mean, this is something which even I follow. What I would say is like, can I have this food? Can I have that food? I would suggest, oh yes, you can have, but provided first you eat my foods and then go for your food. That's it.
So I think the 5 o'clock is a very good idea. Good Probably idea. We should start our nutrition consultation at 5:30.
5:30.
Close by 10. Close by 10, and we have whole day to work for us.
Yeah. Yes,
very true.
But also, see, another thing about PCOS is the insulin resistance. The degree varies with each individual. So some might be able to tolerate, say, 3 idlis or say 2 peseratos. But then there could be someone who just can't handle even that load of carbohydrate. So it's very important to check how much of carbohydrate that they're able to tolerate, and also look at carbohydrate through other sources. Why I'm emphasizing on this point is there are so many women who have actually eaten bowls and bowls of watermelon, papaya, grapes as dinner. And they don't realize the amount of sugars that's getting into their system and causing a spike, and insulin resistance gets worse, and they won't shed weight at all. So if they're not taking a professional's advice, the chances are that they're doing things on their own. They start their day with a bowl of fruits, or else like a fruit smoothie, or else an apple, beetroot, carrot juice. And that's loaded with sugars, and you don't want the fructose and the sucrose getting into your system and playing havoc. So that's one thing that they really need to understand. And stepping up protein, bringing in good fats. Not all fat. Fat is always seen as the villain. So the idea is to just get the healthy fats in, so that all your hormone functions, everything just falls in place. Resistant training or strength training is very crucial, because that helps in reversing the insulin resistance to insulin sensitivity. And rather than just doing cardiovascular exercises, I think it's very important to focus on yoga, because it works on the neuroendocrine system, and of course strength training, because it really helps in improving the metabolic rate, and that is going to have a long-term impact. So it's not like a quick fix, but we are really looking at omega-3, high protein, reducing the carbohydrate, but ensuring that they take complex carbs, removing all forms of sugar, because a lot of people think it's okay to have a lot of brown sugar and honey, but I'm not going to be touching white sugar, which is no. All forms of sugar is out. Sugar is like poison, so that's exactly what I tell, so don't even overdo fruits and all the starchy vegetables. And sometimes even the dals that you have, those big mota chanas that you have, there are people who eat bowls and bowls of chana or sprouts in large quantities, but then if you look at the overall carbohydrate, it's going to be so high and they won't get the results at all. So the idea is to for PCOS especially, focus on this and go to bed on time, ensuring that they work on the exercise aspects, and also writing affirmations, maintaining a journal, because sometimes it's very stressful. If you're going through a challenge and you talk to your friend, then sometimes the news gets around and that becomes fodder for gossip. You get hurt in the entire process. So it's better to either talk to a therapist, but if you don't want to go, then at least start journaling and then tear up the paper. At least, you have just let your, you've done some venting, and that actually helps you deal with a lot of stress. Yeah.
Great.
Wow.
So here Chandrika says, ma'am, good evening. How to motivate a software, mainly a married woman employees working for night shifts?
Oh yeah, it's a big challenge. All these late night work it's a huge challenge. But again, you can't ask someone to quit their job. They could be paying some kind of a loan, or there could be a lot of things at home that has to be taken care of. But I think the main factor is when they return home in the morning, the rest of the household should understand that they need uninterrupted sleep. Because I've worked with so many corporates as well as the BPO sector. And what they would do is they'll return home, say at around 6 a.m. or 7 a.m., eat something and go to bed. They'll wake up after 3 hours, go drop their child in the school, come back, then again try to sleep. You need uninterrupted sleep. 7 to 8 hours of uninterrupted sound, deep restful sleep, and the curtains, everything should be thick so that it cuts out the light. And nobody should enter the room, because every time someone goes and then they're taking something from their shelf or else their cupboard and all that, that little noise is going to disturb them. And someone coming and ringing the door, these are the factors which will disturb their sleep cycle in a big way. And that's the root cause of a lot of hormonal issue. So it's a choice that they are doing for whatever difficult reasons that they have to continue on a night shift. They could be handling people in another time zone completely. But the main thing is if the rest of the family can understand and give them that space so that they can sleep well without any interruption, that will be a big plus. Another thing is also to understand, to have certain foods that will help release serotonin so that they can sleep well. A lot of people, when they go on diets, the main thing that they do is they cut out the complex carbohydrates from their meal. So for dinner, it is good to have that little bit of millets, or else it could even be rice or even chapatis. But then even that 1 or 2 pieces of roti or toast or whatever they are taking, that complex carbs is going to help them sleep well. But if you're going to eat only vegetables or only fruits and all that, then middle of the night they'll wake up and they'll go and raid the fridge or else finish the snack box, and that will disturb their sleep cycle completely. So I think we need to include complex carbs so that the serotonin release is taken care of.
So the satisfaction also counts here.
Yes, absolutely.
Yeah.
So I think time for closing. We are now, it's 5:16.
5:16. Yeah. Good to go for today, doctor.
Yes.
Yeah.
Thank you so much, both of you, for taking your time, very precious time. And we gave us a lot of information and a lot of practical knowledge so people can follow. Thank you. Thank you is a small word for both of you. Vote of thanks, Mayuri.
Yeah, so I would like to give this vote of thanks to both the guest of honor for today, Dr. Sakthivel and Shiny Surendran. Thanks you for being here on Tea Talks and enlightening all our audience with the necessary information and with the nutrition, all the knowledge. Thank you for being here. Thank you so much.
Thank you.
Thank you.
Thank you. Thank you so much. Thanks for having us here. Great audience. And thanks so much for those wonderful questions. Thank you.
And thank you, Dr. Sridhar Kumar, for being here, taking your time. And thank you so much for being here. Yeah. See you all next Tuesday, same time, same place. Bye for today.
Thank you, Dr. Janaki, Mayuri, Dr. Sakthivel, and Shiny. Thank you.
Thank you so much.
Thank you.
Thank you.